Hi, everybody. My name's Lisa Berry, and I'm super excited that you're joining us tonight for our webinar. I am a genetic counselor at Cincinnati Children's Hospital. I work with Dr. Hopkin, and I've been working with families with Fabry disease for about 12 and a half years now. I'd also like to introduce to you Rowena, and she happens to have a way better background than I do tonight. She is a patient with Fabry disease. She'll be speaking to you today about her experiences, and she's going to start off the program by sharing her story. I would like to say that we will be flipping back and forth between Rowena and I, kind of as I talk about some of the more technical things about Fabry disease, and she'll integrate that with her story. Thanks, Rowena.
Thank you for joining us tonight. My name is Rowena, and I am a woman living with Fabry disease. I was born in the Philippines, and I remember being sick a lot as a kid. When I was 6, we moved to California. As I started getting older, I got fever and chills that randomly came on, and my parents often attributed it to being a cold or flu. I often would not go out to play with other kids because I would overheat. At some point when I was around 10 or 12, I had pain in my hands and my feet. My parents took me to the doctor, and the doctor didn't know what was wrong with me. He just said it was growing pains, or it could have been the onset of juvenile arthritis. And since the doctor said that it was probably just from growing pains, I figured that I would just grow out of it someday. But I didn't. When I was 18, I recall coming home from a trip with a fever and chills, and I thought a shower would refresh me. That shower put me in a pain crisis. It was so bad, I almost passed out. It lasted for 2 days. Throughout my 20s, I continued having fevers and chills and pain in my hands and feet. But by this time, life got busy with work, and I had my son. So my focus was on life. Besides, these things were not consistent, so I just moved on. I moved to Seattle. And on Christmas Day in 2005, I was out and about. We had snow the day before, and the temperature really affected my body. It was really bad. Fever, chills, intense pain in my hands and feet, and my face and eyes began to swell. I knew something was really wrong with me. I'd never had swelling before, so I took it seriously and went to the doctor to try and find out what was wrong with me. I went to see my primary care doctor, who sent me to the ER. The ER sent me home with pain meds because they said my lab work was normal. But I was lucky because my primary care doctor really wanted to figure it out. So she decided to send me to specialists, the first being a nephrologist. After looking at my lab work from the hospital, the nephrologist sent me for a biopsy. I will never forget it. He took me page by page through the biopsy report saying, okay, this is great, this is normal, until we got to the last page. That's when he said, you have a rare disease. I felt a sense of relief. I finally had a diagnosis. But then it was an emotional roller coaster. What is Fabry disease? What does this mean for my life? How do I deal with this? So Lisa, can you help us understand why this happened to me?
Sure. Thanks, Rowena, for starting us off. Before we can understand what Fabry disease is, we need to understand what normal looks like. Our bodies are made up of millions and millions of cells, as depicted here on the left. And inside the cell are structures called lysosomes. And the lysosomes are the recycling center of the cells. If we were to look inside a lysosome, we would have a substance called GL3, which is a particular kind of fat. We also have a substance called alpha-galactosidase A, or alpha-gal for short, and that's an enzyme that helps us break down the fatty substances, including GL3, produced in the body's cells. What happens in a typically functioning cell, and specifically inside the lysosomes, is that the alpha-gal is there, and it breaks down the GL3 and recycles it out of the lysosome and into the cell so that the cell can function properly. However, what happens in Fabry disease is that the alpha-gal is either misfolded or there's not enough in there. And so the GL3, instead of getting broken down, continues to build up over time inside the lysosome so that there's more and more and more. And when you get the extreme buildup of GL3, it starts to impact the cells and break them down. When the fatty substance of GL3 builds up, it can start to build up inside the blood vessels, and it can accumulate in the kidney, the heart, and the brain. So for those of you that are struggling with how to describe what Fabry disease is, you can now say that it's an inherited lysosomal storage disorder that causes fatty buildup in the body that your cells cannot get rid of. And this is what causes the symptoms and long-term effects of Fabry disease. So here's some examples of how Fabry disease is inherited. So here on the left, we have an example with an affected male or affected father. So males have one X chromosome and a smaller Y chromosome. Females have two X chromosomes. And Fabry disease in this case is indicated by the red marking on the X of the affected father. When this couple goes to have children, there are 4 different possible outcomes. In each case, the dad gives either his X or his Y. When he gives the X, he will always have a female child because females have 2 X's. So if he gives his X and his partner gives one of her X's, that child will always be female. When the father gives an X, he can only give that affected X with the red marking on it. So the female child that gets the X will always have Fabry disease. So all of this male's daughters will inherit Fabry disease. Now, when the male gives the Y chromosome along with his partner's X, that child, because he's inherited an X and a Y, will always be male. And because the father is always giving a Y to his sons and not the affected X, none of his sons will have Fabry disease. There is never any male-to-male transmission of Fabry disease. Now, on the right, we have an example showing a mother with Fabry disease. So as you can see, again, the male has a regular X and Y, and this female has one X with Fabry disease on it marked in red, and the other does not have Fabry disease. So when this couple goes to have children, the female will either give the X with Fabry or the X without Fabry. You can see the 4 different combinations below that can occur. There's a 50-50 chance that a female child will have Fabry and 50-50 chance that a male child will have Fabry. It all depends on which X the child inherits from the affected mother. So the bottom line is when you have a mother or female with Fabry disease, there's a 50% chance she will pass Fabry disease on to any of her children, regardless of their gender. So whenever we diagnose someone with Fabry disease, there are usually multiple other affected family members, and these individuals should be made aware of the family history and offered testing. And there's actually free testing programs available if they're needed. Okay, so in this slide, we're going to look at what a typical family tree might look like for a family with Fabry disease. So starting at the top, we have an unaffected grandfather who's marked in gray. And then on the right, an affected grandmother who's marked in yellow. So in this case, an affected female. She went on to have 4 children, 2 of whom are affected and 2 of whom are unaffected. So starting with the boy on the left, marked in yellow, we can see that this gentleman has both 1 female child and 1 male child. The female in this case will always have the gene for Fabry disease, so she's affected. We learned that on the previous slide. Her son will have a 50% risk of having Fabry disease, so he will be considered at risk and should be offered testing, and that's denoted in blue. On the other hand, the gentleman's son is a male, so he can never transmit Fabry disease to his son. So you can see here that the gentleman's son is unaffected. And because he does not have Fabry disease, he cannot pass it on to his 2 children. Now on the right, the other daughter that has Fabry disease, none of her 3 daughters have been tested yet, so they're denoted in blue. And all these three daughters would be considered at risk for Fabry disease, and they also should be offered testing. Likewise, all of their children are in the same scenario. Since those women have not been tested, those children should be offered testing, particularly if one of their mothers were to test positive. So the bottom line is you want to make sure that you have a conversation with your immediate family and also with your extended family. Healthcare providers are definitely happy, especially genetic counselors, to help you facilitate that conversation. And if you need, typically you would need documentation of your genetic test results to share with them. So it's always important to get a copy of those. Rowena, do you want to speak a little bit about your family's experience?
Sure. Thank you, Lisa. When I look at my roots from my family in the Philippines, we never talked about medical problems. I didn't really discuss my diagnosis with my parents. However, later in life, my dad, who is biologically my uncle, was on dialysis 3 times a week before he died of kidney failure. I don't know for sure if he had it. As I look right within my own home, my oldest child, my 22-year-old son, and my youngest child, my 8-year-old daughter, both have Fabry. Since Fabry is an inherited disease, if I was to share one lesson with all of you that Lisa mentioned on the previous slide, it is to take responsibility for your entire family. If I would have known earlier in life that someone in my family was affected with this condition, I would have gotten diagnosed earlier, and my symptoms wouldn't have been a mystery for so long. So make sure that you have that conversation with your immediate family and with your extended family. It may be a hard thing to do, but you may be able to help members of your family understand what Fabry is and get the diagnosis and care that you need. Because I knew that I had Fabry and told my doctors, both of my doctors were tested at birth. My youngest was diagnosed, and thankfully she has not had any symptoms yet. But we are able to monitor it together because we are aware of the diagnosis. We didn't know about my son until I was diagnosed, and my geneticist encouraged me to have him tested. My son's symptoms started when he was about 16. He had pain in his hands and feet daily, as well as abdominal pain and other stomach symptoms. So you can see, even though we are from the same family, our symptoms differ. I didn't have the stomach pain or the stomach symptoms like he does, and my hand and foot pain is not consistent like his. So Lisa is going to explain why.
Thanks, Rowena. As Rowena just alluded to, Fabry disease can present in different ways in different patients. So on the left here, we're showing classic Fabry disease, which is also known as type 1 Fabry disease. And this most often presents in males. Onset is typically between the ages of 4 and 8, and these individuals tend to have the symptoms we associate with classic disease, which would be inability to sweat, which is also called hypohidrosis, recurrent fevers, gastrointestinal problems like diarrhea, abdominal or stomach pain. They might also have burning and tingling in the hands and feet. The big word for that is acroparesthesias. They may also have what are called corneal whorls, which is a characteristic finding in the eye, hearing loss, and something called angiokeratomas, which are little purple spots that can be found on the skin. So individuals with the classic form of the disease can also be at risk to develop kidney and heart disease, as well as they have an increased risk for stroke. So in the center, we're showing late onset Fabry disease, or what some people call type 2 Fabry disease. And again, it most often presents in males, but certainly can affect females as well. Onset's a little bit later in life, maybe between the ages of about 25 and 40, but it can be pretty variable. So typically these individuals come to be found because they present with kidney or heart disease. But they certainly can have any of the other symptoms that I listed for classic Fabry disease. And then last on the right, we have females with Fabry disease, which I kind of wanted to put in your own category. So typically females have onset later in life than males, and most of the time their symptoms are more mild than what we might see in their male relatives. But what we need to remember is that some females will have symptoms that are just as severe as males, and others might go their whole lives and never have any symptoms at all. So I think it's important to remember for females is that the majority of females will exhibit some symptoms at some point during their lives, but it's often later in life rather than earlier. Okay, so Fabry disease can happen in males and females, as we just discussed. It can also happen in any race or ethnicity. There are more than 1,000 mutations in the GLA gene. The GLA gene is what's responsible for making that alpha-gal or alpha-galactosidase enzyme. And if you have mutations in there, it causes problems with the enzyme. So some mutations are known to cause classic Fabry disease, and others are known to cause the later onset form. And this is because of how the mutation affects the alpha-gal enzyme. So some mutations might cause a complete absence of alpha-gal, and that typically would result in what we call classic or severe disease. And other mutations might just alter the shape of the alpha-gal and allow it to partially function. So this would be thought to cause a later onset form of Fabry disease. But in spite of everything that we know about various mutations at this point, we definitely can't predict how affected one particular individual might be. In fact, sometimes even people, as Rowena said, with the same mutation in the same family can have very different symptoms. So it is important to kind of look at your relatives and kind of have an understanding for issues that they had. So you might be on the lookout for that in your family. On the other hand, you might also not have the same symptoms, and it's impossible to truly know. Okay, so what might happen in the long term? So over the long term, we really focus on these three organ systems in the body. So the kidneys, the heart, and the brain. So in terms of kidneys, what we know can happen in Fabry disease is that if it's left untreated, you might develop progressive kidney disease. And this is going to happen more commonly in males than females. In some cases, it can lead to kidney failure, which would then require dialysis or a kidney transplant. And that's a pretty big deal. Kidney disease can be silent. So I want people to understand that just because you feel fine doesn't necessarily mean your kidneys are functioning properly. No one can tell if they have late-stage kidney disease. So unless you have certain blood or urine tests, you might feel fine, and you may actually have late-stage kidney disease. And at that point, there's no going back. And so that's why we always say and encourage people to be monitored so that we can check for these types of things, because there are steps we can take to help with that. So in terms of heart problems, Fabry disease might affect the electrical system in the heart, or it might impact the structure or function of the heart. And again, it can also be silent. It can occur when you're feeling perfectly healthy and fine, and you might not know anything is going on until you have certain tests like an EKG, Holter monitor, an echo or echocardiogram, or a cardiac MRI. And these types of issues can progress over time if you're not on treatment, especially. And lastly, for the brain, mainly Fabry disease increases an individual's risk for stroke. And depending on certain factors, your doctors may have you take a daily aspirin or some other preventative medication to help reduce your risk. So some of you may have already seen family members with Fabry disease experience some of these long-term complications. So what can you do about it, and what can you do to prevent it from happening to you? So we're going to use kind of a car analogy, as you can see here. So in order to explain Fabry, we're going to compare Fabry disease to maintaining our car. So Fabry disease progresses over time, and if we don't take care of things, we might have a breakdown. We don't necessarily know which system might develop problems before another. So first off, we always want to make sure we get our oil changed regularly so that the engine will run smoothly. That kind of compares to how we want to monitor our heart in Fabry disease. We know that when we are looking at the heart, there are certain medications that can help protect the heart from Fabry disease. And there are certain devices like a pacemaker that can be placed to help with the electricity in your heart and help it function properly. But the only way to know if you'll need some of these are if your doctors run certain tests to look at your heart. Now, fluids play a huge role in almost every facet of your car. Getting them checked and keeping them at proper level will help make your car last longer. And in this case, we can compare your kidneys and we compare this to your kidneys and kidney function. So we want to monitor our kidneys because we know if the function in our kidneys starts to decline, there are medications that can help protect the kidneys, especially if you're in the early stages of kidney disease. And this can slow down the progression of kidney disease if you have it. So lastly, a car's electrical system. It's relied upon for a smooth operation of the whole car, but most of us probably tend to ignore it. In here, we want to compare this to the brain and the increased risk for stroke. So a brain MRI can tell us if some of the vessels in your brain are tortuous or twisty, and that can increase the risk for stroke. So if you have these tortuous vessels, your doctor may talk to you about ways that you can reduce your risk of stroke. The important thing is that damage can potentially be stopped in the early stages. So you want to make sure you don't wait too long before you have the maintenance done. Okay, so there is a group of Fabry experts that have developed guidelines for how often people should have certain tests for Fabry disease. Every 6 months, we want to have certain blood and urine tests done to look at your kidney function. One of those tests is called creatinine, and in people with kidney disease, it can be elevated or high. You also might get a test called an estimated GFR or an eGFR, which if you're having problems with your kidneys, that eGFR level will be low. And then in the urine, we look to see if there's any protein in your urine, and that can be another indicator of kidney disease. Now, once a year, we'd like to have your heart looked at. That can be with an echo or a cardiac MRI. And we might look at the electricity of your heart with an EKG and sometimes also with a Holter monitor that you wear for a few days. We'll also do a cholesterol or lipid panel to see if you have any additional risk to your heart. And then every 1 to 3 years, if you haven't already had a cardiac MRI, we'd like to see one of those. You can get your hearing tested, have that brain MRI we talked about earlier. And some people have PFTs or pulmonary function tests done, and that's to look at your lung function. Now, if you do find that the physician managing your care does not understand Fabry disease or this kind of maintenance, it's okay to seek help from another physician. And you can do that by reaching out to support organizations who might be able to point you in the right direction for a center that does specialize with Fabry disease. And doctors there can either consult with you or consult with your doctor to kind of talk about all of these recommendations. Okay, so why does maintenance matter? Again, we'd like to prevent or delay long-term complications of Fabry disease, including kidney disease that might lead to the need for dialysis or transplant. We'd like to also prevent or delay cardiac complications and stroke. Rowena, I'd like to pass it back over to you to kind of talk about what your experiences have been with this type of maintenance.
Well, the importance of maintenance cannot be stressed enough. Right after my diagnosis, I was relieved to learn that there was a solution. My nephrologist sent me to a geneticist group at the University of Washington, and that is where my journey of living with Fabry disease began. They started me on infusions, and I learned that Fabry wasn't terminal like cancer. It wasn't going to kill me right away, but I had to understand what can happen to my body in the long term. What they said is that I just had to learn to live with it. So I resigned myself to the idea that I had to keep my mind open and not shut down, and I had to stay focused on my body and my health. I am very active with my care team. I see all my doctors to get checked regularly. I continue with my infusions every 2 weeks, and I take medicine for my heart and my brain. So if I was to share some wisdom with you, it is to surround yourself with the right care team to take care of you and the right people in your life who will support and encourage you. In my family, my husband is my number one supporter. He helps to support me emotionally, with the kids, and with the insurance companies. He handles all of the insurance issues, so I don't have that added stress. And he helps me laugh when I'm down or in pain. My cousin is also a big motivator for me. She encouraged me to train for a half marathon. And while at first I thought, I can't do it, I overheat. To help me overcome those feelings that I had when I was a kid of, I don't want to go out and play, my cousin would call me regularly and say, "Hey, I'm on the treadmill. What are you doing?" And she encouraged me. And I actually did it. I completed 3 half marathons. When I sweat, even a little, I am so happy because I'm doing something good for me. So, some more wisdom. It's so important to reach out and let others know what you need and how they can support you. As you know, we look normal to everyone. Meanwhile, we have to fight within ourselves to keep going. So for me, I go out, I have a full-time job, and I do activities with my kids and with my friends. But I still struggle sometimes. And when I do, I tell my husband or my family or my friends to go without me. And they understand. It is so important to realize that it takes a good support system. So living with Fabry to me is what you make of it. You need to embrace the idea that you're not alone, and openly communicating with your support network can make a huge difference in your life. Lisa, do you have any further thoughts on living with Fabry?
Yes. So you're right, Rowena. Living with Fabry disease, it does take a village and a strong support system. So most of your care will center around your Fabry disease specialist. And this specialist does not have to be one kind of doctor. It might be a genetics doctor or geneticist, a nephrologist or kidney doctor, could be a neurologist, or even your primary care doctor. I've absolutely seen primary care doctors take on that role. As long as the physician is willing to learn, read about Fabry, and stay up to date, they certainly can help you manage your care. So other specialists that you can see here on the left of the slide that might also be involved with a patient with Fabry disease: cardiologist, which is a heart doctor, a neurologist, I think I said that one already, a genetic counselor like me, a pain management specialist, a psychologist or a therapist. There's also ENT, or ear, nose, and throat doctors. They can help with hearing loss or the ringing in the ears. And if you receive infusions, you may have an infusion nurse as well, who would be a very important member of your healthcare team. So we also don't want to forget here on the right, our support network of family and friends, which Rowena, you talked about, are super important. Anything else you would add to this, Rowena?
Yes, for me, not only does it take a village of your care team and your family and friends, but it's also up to you to take charge of your care. When I first started my journey, I was in a honeymoon stage. I was relieved that I knew what was wrong with me, and I just complied and didn't ask any questions. After living with Fabry for a few years, I realized that I had to take charge. So to share some more wisdom, what I learned is that you can't be afraid. You have to ask questions. So how do you know what to ask? You have to get involved. So before, we talked about the importance of our family and friend network. I have learned in order to know what to ask my doctor, I had to get involved with Fabry support groups. At the conferences, you learn from doctors and other patients. And because of that, I now ask a lot of questions. And I learned that you can't be embarrassed to ask questions or ask for something to be explained again. After all, it's my health and it's my family's health. I speak to my care team about what I want for myself, and I ask them if it's possible. If what I want is a no, then no means no, and I accept it. The type of questions that I have asked that may be useful to you related to treatment include questions about taking other medications and how they may impact or be impacted by my infusions. And for the women out there, I asked my doctor specifically about what birth control options were available to me. Are some of the symptoms that you have during or after infusions normal? And when I was already on treatment for many years and wasn't having side effects from my infusions, I asked about stopping some of the pre-meds and also ways to shorten my infusion time. Are there other options to get my infusions closer to home? Is there flexibility with my infusion date so I can take a vacation? As many of you know, this may cause an issue with insurance coverage. And I learned that if my doctor writes plus or minus 2-3 days on my infusion prescription, then I can get the flexibility I need to enjoy time away. Or now that I've been on infusions for so long, I'm having some trouble with my veins, so I'm talking to my doctors about putting a port in. I also make sure I stay up to date on what's going on with new treatment options and ask my doctors what they've heard and what options can be considered for me. So my take-home message to you is that you have to get involved with your care team and with your family and friends to be involved and to take charge of your Fabry. And also get involved with the Fabry support groups. My care team recommended that I attend conferences, and I did. I actively participate at the conferences and ask questions and learn more things to ask my doctor. I also network with other patients to learn from their experiences too. At NFDF, you are introduced to families. I have stayed in touch and we talk about our experiences. This really helps. So if you go, you can start building a network there. They also have a family camp. It's a whole weekend away and there are activities and plans for the kids, and it's a lot of fun for them. We go and have met other families that we stay in touch with. By attending other Fabry conferences, I have met other people. I met another patient from Dallas and we've become great friends. We connect all the time and talk about life. Both NFDF and FSIG have a big Facebook presence and have good programs that you can check in on. I highly encourage you to look into these. They have lots of resources, doctors all over the United States that specialize in Fabry that they can get you in contact with. If your doctor doesn't understand Fabry, or you don't feel that you're getting the right care, you can find a doctor through these organizations. They will help you find a Fabry specialist in your area. These organizations really help connect you to doctors, to other patients, and to information that can really help us. I think we can all agree that Fabry can be scary. My hope for you is that you don't dwell on the bad stuff. We all live in pain. We all feel at times that our world may be closing in. And what works for me is to change my perspective. I embrace each moment at a time. I take one step at a time. And I deal with one thing at a time. While I know Fabry disease is lifelong and has taken over my life, it is not my life. Fabry does not define who I am, and it does not have to define who you are either. I'm a walking, talking, normal person. And when I change my perspective and take charge of my life, I can see that there are many other things in life worth living for. My final thought to leave you with tonight: keep living. Lisa, would you like to share your final thoughts?
Thanks, Rowena. I'm not sure I can say anything better than what you just said. That was wonderful. Thank you so much. This is our summary slide. So just final thoughts that we have are, Fabry disease is an inherited lysosomal storage disorder that can cause a fatty buildup of GL3 in the body, and your body and cells cannot get rid of it without treatment. Since Fabry disease is inherited, talk about it with your immediate family and also your extended family, because it might help them get diagnosed sooner. As we kind of saw with Rowena's example, that she went quite a long time without knowing, and I bet that's happened to a lot of you out there as well. Fabry disease overall is sort of like taking care of our cars. Maintenance matters. By staying on top of your health today, it might prevent or delay some of the long-term impacts of Fabry disease down the road. Make sure that you try to surround yourself with a good care team and support network. If your doctor doesn't understand Fabry disease, seek guidance from a doctor who does. And lastly, you have to get involved to be involved. So ask questions, get involved with the Fabry support networks that Rowena mentioned, and we can give you more information about that if you need it. And make sure that you stay active with your family and friends.